discuss about traction maneuvers and the balancing techniques involved in adolescent orthopedic scoliosis surgery. The traction maneuvers has evolved over a period of time along with the instrumentation evolution, and one has to be aware of the various maneuvers that are being used. It varies from compression distraction to cantilever technique, and one should be very much oriented towards the different type of deformities that is seen in a single patient so that a proper maneuver can be used. The commonest maneuver which is being used as a fine tuning for a shoulder balance is the compression distraction maneuver, where one compression being used on the convex side of the lumbar curve, it produces lordosis. The distraction maneuver is used most commonly in the thoracic curve. Once it is used, it produces not only correction of the curve, but also it produces kyphosis. The translation maneuver, which was first developed by Luque using a wire and rod technique, is being commonly used now with a lot of pedicle screws and extenders. Here, the rod is placed in sagittal profile at the upper and the lower instrumented vertebra and loosely locked, and the spine is translated towards the rod. The Rod-derotation maneuver is used by Cottrell and Dubosset, where he advocated to use the working rod as the concave rod on the thoracic scoliosis and convex rod as the working rod in case of a lumbar scoliosis. However, it basically produces derotation of the vertebrae in an opposite direction, and hence it produces a worsening of the thoracic hump. The vertebral derotation maneuver is most commonly used nowadays with the advent of a pedicle screw, where the vertebra is derotated opposite to the rod derotation maneuver. And in this maneuver, there are two types of vertebral derotation. One is an en bloc vertebral derotation, another is a segmental vertebral derotation. The only difference is being the segmental vertebral derotation is being done in a single vertebra, whereas in en bloc, 3 or 4 vertebrae are used together so that the ploughing of screws is reduced. Because the ploughing of the screws might produce the damage to spinal cord and even damage to the major blood vessels. The differential rod contouring is a part of various maneuvers where, for example, in case of an type 1 thoracic curve, the rod is hyperbent in the concave side and hyperbent on the convex side. This differential rod contouring helps in not only translation and also derotation of the spine. The cantilever maneuver is being most commonly used for an hyperkyphosis, where the rod is locked onto the one end and it is being pushed and then applied to the distal end. The principle of scoliosis surgery is to correct the deformity with the minimal levels of fusion and also to have a balanced spine without producing any new deformities. In case of a shoulder balance, there are various parameters that are available to measure, like coracoid height difference, patellar angle, T1 tilt, but none of the parameters whichever I'm talking cannot be reproduced intra-op because the patient is in prone position. We have to have a proper level shoulders. One has to select the proper UAV and also a correction maneuver during intra-op. In a right side shoulder being high level, one has to compress on the right side and has to distract on the left side and to have a maximal correction of the thoracic curve in case of a type 1 linkage. However, the amount of correction has to be assessed based on this parameter called as a UAV tilt angle proposed by Kwan et al., where it is calculated based on the pre-op cervical and supine side bendings, and that tilt angle is being reproduced intra-op so that we can have a proper post-op shoulder balance. The truncal balance, especially with the selective thoracic fusion for link A1C and 2C, is based on this parameter, which is the undercorrection of the thoracolumbar curve. Undercorrection of the thoracic curve. Because when a thoracic curve is completely corrected, we expected the lumbar curve to completely become straight, but doesn't happen, and it might result in imbalance in the form of coronal decompensation, lumbar decompensations. However, if you do an undercorrection of the thoracic curve, it ends up in a properly balanced spine. To conclude, the correction maneuver sequences that has to be used during any scoliosis surgery is being listed out in the step-by-step manner. And to have a proper balance, one has to do a proper preoperative planning, a clear-cut knowledge about the correction maneuvers that has to be used, and undercorrection principle has to be kept in mind so that we can have an harmonious correction. Thank you.